Stop scrolling. This could save your life. If your heart starts failing while you are alone, there will be no warning siren, no dramatic collapse in slow motion, and no one bursting through the door to rescue you. There will only be a sensation in your chest, a wave of discomfort that feels slightly unusual, slightly wrong, and a small voice inside your head trying to convince you that it is nothing serious. What you decide in the next few minutes will determine whether you survive or whether permanent damage begins inside your body. Most people die not because the heart attack was unstoppable, but because they hesitated, they doubted, they waited. This is not the moment to wait. This is the moment to act. Today you are going to learn exactly what to do if you ever experience a heart attack while alone. And I need you to pay attention as if your life depends on it, because one day it might. Understand what is actually happening inside your chest. A heart attack, medically known as a myocardial infarction, occurs when blood flow to a part of your heart muscle becomes blocked, usually by a clot that forms on top of a ruptured plaque inside a coronary artery. That blockage stops oxygen from reaching a section of your heart. Without oxygen, heart cells begin to die. Not weaken, not struggle, die. The damage does not wait politely. It begins within minutes. The longer the artery remains blocked, the larger the area of heart muscle that is permanently destroyed. This is why doctors repeat one phrase over and over again: time is muscle. When you are alone, time becomes even more dangerous, because there is no one to recognize the signs for you, no one to call emergency services on your behalf, and no one to insist that you stop minimizing what your body is clearly telling you. You must recognize it yourself. Step 1. Recognize the warning signs without denial. The first step to surviving a heart attack alone is brutal honesty with yourself. A heart attack does not always look like someone clutching their chest and collapsing dramatically. In reality, it often begins as pressure, tightness, fullness, or squeezing in the center of the chest. It may feel like something heavy is sitting on you. The discomfort can spread to the left arm, both arms, the back, the neck, the jaw, or even the stomach. You may feel short of breath. You may break into a cold sweat. You may feel nauseated. You may feel dizzy. Some people, especially women, experience unusual fatigue, indigestion-like discomfort, or back pain rather than classic chest pain. Here is the dangerous part. The brain wants to protect you from fear. It will try to label the sensation as something harmless: gas, anxiety, muscle strain, bad posture. If chest pressure or discomfort lasts more than 5 minutes, especially if it is accompanied by sweating, breathlessness, nausea, or radiating pain, you must assume it is a heart attack until proven otherwise. Assume the worst so you can create the best possible outcome. Denial kills. Action saves. Step 2. Call emergency services immediately. This is the most important step, and it must come before anything else. Do not call a friend. Do not text your family. Do not search your symptoms online. Do not wait to see if it passes. The moment you suspect a heart attack, call your local emergency number. Emergency medical teams can begin treatment the second they reach you. Paramedics carry oxygen, cardiac monitors, defibrillators, clot-busting medications, and communication systems that alert hospitals before you even arrive. If your heart rhythm becomes unstable, they can intervene immediately. If you try to drive yourself and collapse behind the wheel, you endanger yourself and everyone else on the road. Put your phone on speaker so your hands are free. Unlock your door if you can safely do so. Sit down while speaking to the dispatcher and clearly state that you believe you are having a heart attack. Stay on the line. Follow instructions carefully. Every minute between symptom onset and medical intervention affects how much heart muscle survives. Do not negotiate with time. Step 3. Chew aspirin if it is safe for you. If you are not allergic to aspirin and you do not have a medical reason to avoid it, chewing a full-strength aspirin or 4 baby aspirins can help slow the clotting process that is blocking your artery. It is important to chew the aspirin rather than swallow it whole, because chewing allows it to enter your bloodstream faster through the lining of your mouth and stomach. Aspirin is not a cure. It does not magically reopen the artery, but it can slow clot expansion, and that can preserve precious heart muscle while you wait for emergency professionals. However, Never take aspirin if you have been told by a doctor to avoid it, if you have a severe allergy, or if the dispatcher advises against it based on your medical history. This is a supportive measure, not a replacement for emergency care. Step 4. Sit down and reduce the heart's workload. When the heart is deprived of oxygen, every extra demand placed upon it increases damage. Walking around, pacing, panicking, or attempting to gather belongings forces your heart to work harder at the exact moment it is struggling. Sit upright with your back supported. Do not lie flat unless you feel faint. Loosen tight clothing around your neck and chest. Keep your movements minimal. Your goal is simple. Reduce the oxygen demand of your heart until professional care arrives. The more still and calm your body remains, the less strain your heart experiences. This is not the time to be brave. It is the time to be strategic. Step 5. Take nitroglycerin only if it was prescribed to you. If you have previously been diagnosed with heart disease and have been prescribed nitroglycerin, take it exactly as your doctor instructed. Nitroglycerin works by widening blood vessels, which can improve blood flow and reduce the heart's workload. Place it under your tongue as directed and allow it to dissolve. Never take someone else's medication. Never experiment with drugs during a crisis. Only use medications that were prescribed specifically for you. Step 6. Control panic before panic controls you. Fear is natural, but uncontrolled panic can make the situation worse. When fear surges, adrenaline floods your bloodstream. Adrenaline increases heart rate and blood pressure. That forces the heart to work harder. A heart that is already oxygen-starved cannot afford that extra demand. You must actively control your breathing. Inhale slowly through your nose for 4 seconds. Exhale slowly through your mouth for 6 seconds. Keep your shoulders relaxed. Keep your body still. Slow breathing helps stabilize your nervous system and prevents a dangerous spike in heart workload. You are not trying to eliminate fear. You are preventing fear from accelerating damage. Calm is not weakness. Calm is survival. What you must never do. There are several deadly mistakes people make during a heart attack when alone. Do not wait for the pain to disappear. Do not convince yourself that you are overreacting. Do not drive yourself to the hospital. Do not go to sleep hoping you will feel better in the morning. Do not attempt internet home remedies. And do not rely on so-called cough CPR techniques promoted online. That method is not a reliable self-rescue strategy outside highly monitored hospital environments. It should never replace calling emergency services. The only proven path to survival is rapid medical intervention. Why people die alone during heart attacks. Most solitary heart attack deaths are not caused by unstoppable damage. They are caused by delay. People hesitate because they are embarrassed. They hesitate because they fear being wrong. They hesitate because they think they are too young, too healthy, too active, or too careful. Heart disease does not negotiate with your self-image. It does not care about your gym membership. It does not care about your diet this week. It does not care about your age if plaque has silently built up inside your arteries for years. The body whispers before it screams. If you ignore the whisper, you may not survive the scream. If you live alone, prepare now. If you live alone, preparation is not paranoia. It is responsibility. Keep your phone charged at all times. Store emergency numbers in your favorites. Keep aspirin in an accessible location if it is safe for you to take. Inform trusted neighbors or family members about any known heart conditions. Know your medical history. Preparation reduces hesitation. Hesitation increases mortality. The reality of survival. The difference between survival and permanent heart failure often comes down to how quickly blood flow is restored. When treatment begins within the first hour, survival rates increase dramatically. When people delay several hours, damage expands and recovery becomes harder. If you act immediately, you give doctors a fighting chance to reopen the blocked artery, restore circulation, and preserve your heart function. If you wait, you shrink that window. This is not meant to scare you. It is meant to wake you up. Final message. If you ever feel persistent chest pressure, shortness of breath, radiating pain, sweating, nausea, or sudden unexplained weakness while alone, do not debate with yourself. Call. Act. Chew aspirin if safe. Sit down. Breathe slowly. Stay on the line. Minutes matter. Most people who survive a heart attack say they almost ignored it. Do not become part of that statistic. If this information reaches you today and you remember it tomorrow, it may save your life next year. Share it with someone who lives alone, because survival is not about luck. It is about decisive action when it matters most.